Dengue. Dengue or breakbone fever is a viral infection that spreads from mosquitoes to people. It is more common in tropical and subtropical climates. Most people who get dengue will not have symptoms. But for those who do, the most common symptoms are high fever, headache, body aches, nausea, and rash. Most will get better in 1 to 2 weeks. Some people develop severe dengue and need care in a hospital. In severe cases, dengue can be fatal. You can lower your risk of dengue by avoiding mosquito bites, especially during the day. Dengue is treated with pain medicine, as there is no specific treatment currently. Symptoms. Most people with dengue have mild or no symptoms and will get better in 1 to 2 weeks. Rarely, dengue can be severe and lead to death. If symptoms occur, they usually begin 4 to 10 days after infection and last 4 to 7 days. Symptoms may include high fever, severe headache, pain behind the eyes, muscle and joint pains, nausea, vomiting, swollen glands, rash. Individuals who are infected for the second time are at greater risk of severe dengue. Severe dengue symptoms often come after the fever has gone away. Severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums or nose, fatigue, restlessness, blood and vomit or stool, being very thirsty, pale and cold skin, feeling weak. People with these severe symptoms should get care right away. After recovery, people who have had dengue may feel tired for several weeks. Test result. Dengue IgM antibody testing is recommended in combination with nucleic acid amplification tests, or NS1 antigen tests, during the first 7 days of illness. Dengue IgM antibody testing is recommended in combination with nucleic acid amplification tests, or NS1 antigen tests, during the first 7 days of illness. IgM antibody testing can identify dengue infections, but cross-reactivity with other flaviviruses should be considered when interpreting results, diagnostics, and treatment. There is no specific treatment for dengue. The focus is on treating pain symptoms. Most cases of dengue fever can be treated at home with pain medicine. Acetaminophen is often used to control pain. Nonsteroidal anti-inflammatory drugs like ibuprofen and aspirin are avoided as they can increase the risk of bleeding. For people with severe dengue, hospitalization is often needed. Transmission of dengue. The dengue virus is transmitted to humans through the bites of infected female mosquitoes, primarily the Aedes aegypti mosquito. Other species within the Aedes genus can also act as vectors, but their contribution is normally secondary to Aedes aegypti. However, in 2023, surge in local transmission of dengue by Aedes albopictus or tiger mosquito has been seen in Europe. After feeding on an infected person, the virus replicates in the mosquito midgut before disseminating to secondary tissues, including the salivary glands. The time it takes from ingesting the virus to actual transmission to a new host is termed the extrinsic incubation period. The extrinsic incubation period takes about 8 to 12 days when the ambient temperature is between 25 to 28 degrees Celsius. Variations in the extrinsic incubation period are not only influenced by ambient temperature. Several factors such as the magnitude of daily temperature fluctuations, virus genotype, and initial viral concentration can also alter the time it takes for a mosquito to transmit the virus. Once infectious, the mosquito can transmit the virus for the rest of its life. Human-to-mosquito transmission. Mosquitoes can become infected by people who are viremic with the dengue virus. This can be someone who has a symptomatic dengue infection, someone who is yet to have a symptomatic infection. They are pre-symptomatic, and also someone who shows no signs of illness. They are asymptomatic. Human-to-mosquito transmission can occur up to 2 days before someone shows symptoms of the illness, and up to 2 days after the fever has resolved. The risk of mosquito infection is positively associated with high viremia and high fever in the patient. Conversely, high levels of DEN-V-specific antibodies are associated with a decreased risk of mosquito infection. Most people are viremic for about 4 to 5 days, but viremia can last as long as 12 days. Maternal transmission. The primary mode of transmission of the dengue virus between humans involves mosquito vectors. There is evidence, however, of the possibility of maternal transmission from a pregnant mother to her baby. At the same time, vertical transmission rates appear low, with the risk of vertical transmission seemingly linked to the timing of the dengue infection during the pregnancy. When a mother does have a dengue infection when she is pregnant, babies may suffer from preterm birth, low birth weight, and fetal distress. Other transmission modes. Rare cases of transmission via blood products, organ donation, and transfusions have been recorded. Risk factors. Previous infection with dengue increases the risk of the individual developing severe dengue. Urbanization is associated with dengue transmission through multiple social and environmental factors. Population density, human mobility, access to reliable water source, water storage practice, etc. Community risks to dengue also depend on a population's knowledge, attitude, and practice towards dengue. The exposure is closely related to behaviors such as water storage, plant keeping, and self-protection against mosquito bites. Routine vector surveillance and control activities engaging community greatly enhances a community's resilience. Vectors might adapt to new environments and climate. Interaction between dengue virus, the host, and the environment is dynamic. Consequently, disease risks may change and shift with climate change in tropical and subtropical areas. In combination with increased urbanization and movement of populations, prevention and control. The mosquitoes that spread dengue are active during the day. Lower the risk of getting dengue by protecting yourself from mosquito bites by using 1. Clothes that cover as much of your body as possible. 2. Mosquito nets. If sleeping during the day, ideally nets sprayed with insect repellent. 3. Window screens for mosquito repellents, and 5. Coils and vaporizers. Mosquito breeding can be prevented by 1. Preventing mosquitoes from accessing egg-laying habitats by environmental management and modification. 2. Disposing of solid wastes properly and removing artificial man-made habitats that can hold water. 3. Covering, emptying, and cleaning domestic water storage containers on a weekly basis. 4. Applying appropriate insecticides to outdoor water storage containers. If you get dengue, it's important too. 1. Rest. 2. Drink plenty of liquids. 3. Use acetaminophen for pain. 4. Avoid non-steroidal, anti-inflammatory drugs like ibuprofen and aspirin. And 5. Watch for severe symptoms and contact your doctor as soon as possible if you notice any. Dengue vaccine. So far, one vaccine has been approved and licensed in some countries. However, it is recommended only for the age group of 6 to 16 years in high transmission settings. Several additional vaccines are under evaluation. By Josh E. Joseph. Thank you.